Many women feel embarrassed about this, but truly, it's incredibly common. In this video, I'll explain what's happening in your body, why so many women experience this, and most importantly, what you can do to feel comfortable and confident again. First, let's see what vaginal dryness exactly is. Vaginal dryness simply means that the skin and tissues in and around the vagina no longer hold moisture the way they used to. Normally, the vaginal tissues produce natural lubrication to keep everything soft, supple, and protected. But during menopause, this changes. The skin becomes thinner, more sensitive, and sometimes a bit fragile. This doesn't mean anything is wrong with you as a woman. It's a natural response to hormonal changes, just like changes in your skin, sleep, or energy. Why is vaginal dryness so common in menopause? The main cause is the drop in estrogen. Estrogen helps the vaginal tissues stay elastic, well-blooded, and naturally lubricated. As estrogen levels decline, several things happen. Blood flow decreases due to estrogen decline. The tissues produce less moisture. The vaginal skin becomes thinner and more delicate. Most women notice these changes between ages 45 and 55, but it can start earlier or later. Some women tell me they feel like their whole body becomes drier, skin, eyes, and vagina. And yes, that's all connected to the same hormonal shift. Common symptoms. The symptoms vary from woman to woman, but the most common ones include a burning sensation, especially when moving or after urinating, itching or irritation, pain during intercourse, reduced desire simply because it hurt, small cracks or tears in the skin due to dryness, an increase in urinary tract infections. And remember, these symptoms are real, physical changes, not something in your imagination. What can you do yourself? The good news is that there are many things you can do to reduce vaginal dryness. Think of it as several small habits that work together to make a big difference. Hydrating gels or vaginal moisturizers. Using a moisturizer daily or several times a week can support the tissues. Choose products without perfume, alcohol, or irritating ingredients. Worldwide available examples are KY and Durex, not recommendations, just common brands that are easy to find. Use lubricant during sex. Lubricant isn't a luxury, it's comfort. Some options to explore. Water-based lubricant, gentle and easy to wash off. Silicone-based lubricant, lasts longer, ideal for severe dryness. These types are widely available from well-known brands. Wear breathable underwear. Cotton or bamboo underwear allows the skin to breathe and reduces irritation. Avoid synthetic fabrics that trap heat and moisture. Be mindful of tight clothing. Tight jeans, leggings, or shapewear can cause rubbing and pressure. Looser clothing can offer immediate relief on days when symptoms are stronger. Avoid irritating products. Be careful with scented soaps and washes. Intimate sprays or deodorant. Scented panty liners. Strong laundry detergents or fabric softeners. Choose mild, fragrance-free alternatives. Avoid vaginal douching or internal rinsing. This one is important for vaginal health. Douching disrupts the natural pH balance and removes healthy bacteria. It can actually increase dryness, irritation, and infections. The vagina cleans itself, you only need to wash the external area gently with water. Hydration and nutrition. Healthy nutrition supports your tissues from within. Lifestyle choices may help support vaginal health. Omega-3 fats, salmon, sardines, walnuts, chia, flaxseed. Healthy fats, avocado, olive oil, nuts. Plenty of vegetables and fiber. Drinking enough water. Certain factors may worsen symptoms for some women. Too much coffee. Alcohol. Spicy food. Sugar. This isn't about rules, it's about noticing what feels good for your body. Heat and blood flow. Gentle heat can help relax the muscles and increases blood flow. A warm shower, heating pad on the lower belly, gentle stretching or a short walk can help immediately. Relax the pelvic floor. Many women unknowingly tense their pelvic floor, especially when sex becomes painful. Over time, tension can make dryness worse. Gentle breathing, relaxation exercises, and awareness of the pelvic area can do wonders. Sexual activity, with or without a partner. Regular sexual arousal increases blood flow to the vaginal tissues, which helps reduce dryness. This can be with a partner or solo, whatever feels right for you. 11. Limit daily use of panty liners. They can create friction and trap moisture. If you do use them, choose fragrance-free, breathable options. The most important thing to remember is this. Small, consistent steps can make a noticeable difference within a few weeks. When should you see a doctor? Don't hesitate to see your doctor if the pain continues despite trying different solutions. You have recurrent urinary tract infections. You experience vaginal bleeding outside your period. Intercourse has become too painful to enjoy. There are treatments available, such as local estrogen creams or vaginal tablets, which work directly on the tissues. They affect only the local area and have minimal impact on the rest of the body. Many women experience significant improvement with them. Vaginal dryness during menopause is very common, but that doesn't mean you have to suffer through it. You deserve comfort, pleasure, and confidence in your own body. I hope this video gave you clarity and helpful tools to start feeling better again. If this helped you, feel free to let me know, and remember, you are not alone in this.